This segment of KPVI More is brought to you in part by Pocatello Women's Health Clinic.
Urinary incontinence is a common problem for women as they grow older.
Joining us now is Dr. Kim Cox with the Pocatello Women's Health Clinic. Dr. Cox, thank you so much for joining us.
Glad to be here, Libby.
I've seen a stat of like 13 million Americans deal with this. Is it that common?
I think it's significantly higher than that. As many as 50% of women, as they progress through their life, may experience urinary incontinence, whether it's just after childbearing or as a result of growing older, chronic cough, repetitive lifting. There are lots of different things that will produce urinary incontinence. It affects a lot of women.
Wow.
So is this the body's deteriorating? Is it the body not keeping up? Is there something going on internally that's
a very interesting question. It certainly can be due and is strongly associated with the trauma related to childbirth, but some of it even occurs in women who have had only cesarean sections. It occurs as a result purely of aging in women who haven't had children, and then there are some occupational issues related to repetitive lifting or chronic cough that will do it also.
So there's quite a spectrum of how serious this can be, correct?
There's a spectrum, and there's a spectrum of causes.
Okay.
Some patterns are related to just not being able to feel the urge to go to the bathroom and then not being able to get to the toilet in time. Other women leak only when they cough or sneeze. So it's important in approaching treatment to be able to sort out what the particular type is. The symptoms may not always be clear, so there's testing and physical exam characteristics that will help us to decide what exactly the type is and what the best treatment is.
So you mentioned the spectrum of causes. What can be done, because everybody is different, what can be done on a, I guess, a universal level to prevent this?
Prevention is very difficult because it is a process of normal human life.
Okay.
So rather than prevention, it would be more improvement,
okay,
and then treatment. And again, depending upon the type, those treatments may be, obviously we want to use the least invasive or least risky treatments initially, and so that can be anywhere from physical therapy, we can use exercises. Since I've been in practice, many very effective medications have come out to help, and then as a last resort, if depending upon the type, surgery may be a possibility that will be very helpful.
Now this is something that, you know, maybe you might giggle about in the corner, but this is something that can really affect people's lives.
It affects them tremendously. They stop exercising, they stop traveling, they memorize where the bathroom stops are, wherever they have to go. Many women withdraw from their social activities because they are concerned that it's going to cause, they're going to have an accident, or that they won't smell appropriately when they're out in the community. So it's a big issue, and even if you just consider the cost of feminine hygiene products, it's a huge market.
Now, as we mentioned, 13 million, that's a lot of people, and like you said, that might be a conservative number. So it's important when you seek treatment to kind of understand, hey, you're not alone in this.
Absolutely not. And many women interpret that it is a normal part of aging and that they just have to accept it, and that's simply not the case.
And I think sometimes people are worried that it'll go straight to surgery, and that's not the case at all.
That's not the case at all. In fact, the recommendations are to try conservative therapies first. Many times the symptoms are mixed and there are two different causes that are occurring at the same time, and so we can apply the least technologically advanced therapy in order to minimize risk, minimize cost, minimize adverse consequences.
Right. Fantastic. Well, thank you so much for coming on the show. If people would like to ask you questions about it, can they contact you? Or
absolutely. They can contact my office at Pocatello Women's Health Clinic.
Okay, fantastic. Thank you so much for coming on the show. We appreciate that. And when we come back, we're going to have your answers to our question of the day.